If you're enjoying this Med Prep to Go Step 1 podcast, you can now get the content along with the content of the Crush Step 1 podcast ad-free in one bundle. Just go to medprep2go.com and find our new subscription podcast called Med Prep to Go Step 1 Bundle.
Meet the computer you can talk to. With Copilot on Windows, working, creating, and collaborating is as easy as talking. Got writer's block? Share your screen with Copilot Vision to help spark inspiration, and use Copilot Voice to have a conversation and brainstorm ideas. Or maybe you need some tech help. With Copilot Vision, Copilot sees what you see. Let Copilot talk you through step-by-step guidance so you can master new apps, games, and skills faster. Try now at windows.com/Copilot.
Hi, everyone. This is Ted O'Connell. I just want to let you know that we have launched a Step 2 QBank podcast, very similar to our Step 1 QBank podcast. Each episode will have 3 questions so that you can study on the go. We are actively recording these and plan to release a new episode every 2 weeks. We're also launching a premium podcast bundle that will include ad-free access to USMLE Step 2 Secrets podcast, as well as early and ad-free access to all of our episodes from the Step 2 QBank podcast. So please go over to our website at medprep2go.com and check these out, or you can access them wherever you get your podcasts. Thanks so much.
This is Dr. Ted O'Connell with the Med Prep to Go podcast. Today we'll be reviewing 3 pathology questions. Just a reminder that you can find these questions and many more on our website at medprep2go.com. If you have feedback or you'd like to get involved with this project, please reach out to me at ted.medprep2go@gmail.com. If you like what we're doing, please review us and tell your friends, and don't forget to subscribe to the podcast as well. You can learn more about me and my new books and projects at tedxoconnell.com. All right, let's get started with the first question. A 42-year-old woman presents to the emergency department with severe muscle weakness and abdominal cramping, which has been worsening over the last 3 days. She reports a history of hypertension and has been taking hydrochlorothiazide 50 milligrams daily for the past year. She also reports occasional use of a laxative for constipation and a daily vitamin D supplement. She denies use of any illicit substances. Vital signs are within normal limits, and physical examination is unremarkable. Laboratory tests reveal hypokalemia with a potassium level of 2.5 milliequivalents per liter. Which of the following is the most likely cause of this patient's hypokalemia? A, adrenal insufficiency, B, diuretic use, C, excessive intake of laxatives, D, excessive intake of vitamin D, or E, inadequate intake of potassium. The correct answer is B, diuretic use. The patient's history of taking hydrochlorothiazide, a diuretic, for a prolonged period of time, combined with their symptoms of muscle weakness and abdominal cramping, suggests that the hypokalemia may be due to the diuretic, causing the body to lose excess amounts of potassium through the urine. Answer choice A, adrenal insufficiency, is incorrect. The patient does not have other symptoms typically associated with adrenal insufficiency, such as fatigue and weight loss, and she has normal vital signs, which make it less likely that the hypokalemia is due to adrenal insufficiency. However, it is still a possibility, and further testing may be needed to confirm or rule out this diagnosis. Answer choice C, excessive intake of laxatives, is incorrect. It is unlikely that the patient's hypokalemia is due to laxative abuse, given her only intermittent use of a laxative. Answer choice D, excessive intake of vitamin D, is incorrect. Vitamin D does not directly cause hypokalemia. Answer choice E, inadequate intake of potassium, is incorrect. Inadequate intake of potassium alone is unlikely to cause hypokalemia in a patient taking a diuretic, as the diuretic would cause the body to lose excess potassium through the urine. The key learning point in this question: hydrochlorothiazide can cause hypokalemia, which can manifest with symptoms such as muscle weakness and abdominal cramping. To the emergency department by ambulance with symptoms of fatigue, dizziness, and confusion. Her friend reports these symptoms have been present for the past 2 days. She has a history of major depressive disorder, hypertension, alcohol use disorder, and recurrent urinary tract infection. She takes fluoxetine and lisinopril. Vital signs are within normal limits. Physical examination reveals that the patient is oriented only to self. The patient is found to have hyponatremia with a serum sodium level of 122 milliequivalents per liter and normal renal function. Urine sodium is 50 milliequivalents per liter, and urine osmolality is 390 milliosmoles per kilogram. Which of the following is the most likely cause of this patient's hyponatremia? A, adrenal insufficiency, B, heart failure, C, primary polydipsia, D, renal tubular acidosis, or E, syndrome of inappropriate antidiuretic hormone secretion, or SIADH. The correct answer is E, syndrome of inappropriate antidiuretic hormone secretion. SIADH is a condition in which the body inappropriately secretes antidiuretic hormone, or ADH, leading to an excess of water retention and hyponatremia. This is the most likely cause in the given scenario, as the patient is normovolemic and takes fluoxetine, a selective serotonin reuptake inhibitor, which is associated with SIADH. The high urine sodium and high urine osmolality support a diagnosis of SIADH. Answer choice A, adrenal insufficiency, is incorrect. Adrenal insufficiency, also known as Addison disease, is a condition in which the adrenal glands do not produce sufficient hormones, including cortisol. This can lead to hyponatremia due to impaired water and electrolyte regulation. However, this is less likely in the given scenario, as the patient's presentation is more consistent with SIADH. Answer choice B, heart failure, is incorrect. Heart failure can cause hyponatremia due to the accumulation of fluid in the body, leading to dilutional hyponatremia. However, this is less likely in the given scenario, as the patient does not have signs or symptoms consistent with heart failure, nor any history of heart failure. Answer choice C, primary polydipsia, is incorrect. Primary polydipsia is a condition in which an individual drinks an excessive amount of water due to an abnormal thirst drive. This can lead to dilutional hyponatremia. However, this is not the most likely cause in the given scenario, as the patient has a history of alcohol use disorder, which is often associated with other causes of hyponatremia, such as SIADH or adrenal insufficiency. Answer choice D, renal tubular acidosis, is incorrect. Renal tubular acidosis is a condition in which the kidneys are unable to properly acidify the urine, leading to an excess of bicarbonate in the blood and hyponatremia. The laboratory findings provided are not consistent with the diagnosis of renal tubular acidosis. The key learning point here: selective serotonin reuptake inhibitors are one potential cause of SIADH. A normovolemic state with elevated urine sodium and elevated urine osmolality support this diagnosis.
This episode is brought to you by... Oops! I've got a box of Cheez-It crackers staring at me, and I just wanted that irresistible cheesy crunch. Sorry, that was a total snacksident. What was I supposed to be talking about? So salty, so crunchy, so cheesy. Whoops, lost my train of thought. I've heard of brain freeze, but brain cheese? I'll just have one more Cheez-It cracker, and then I'll get back to it.
This episode is brought to you by Netflix. Jay Kelly, the new film from Academy Award nominee Noah Baumbach. George Clooney stars as an actor confronting his past and present on a journey of self-discovery, alongside Adam Sandler as his devoted manager. Critics are calling it a declaration of love to the chaotic art of filmmaking, with the Wall Street Journal praising it as a transcendent comedy drama. Jay Kelly is now playing only on Netflix.
Question 3. A 48-year-old woman presents to her primary care physician with complaints of pain and numbness of her right hand for the past month. The patient describes the pain as a burning sensation that wakes her up from sleep at night. She also experiences pain and numbness along the first 3 fingers of her right hand while unscrewing tight bottles. She used to work as a banker, spending several hours working on her computer every day. She quit her job a year ago to spend more time with her family. She has no complaints of recent trauma, fever, or other joint pains. She does not drink alcohol, smoke cigarettes, or use illicit drugs. She does not take any medications currently. Vital signs are normal. On physical examination, pain is reproduced by asking her to flex her wrist at 90 degrees. Which of the following can be used to confirm the most likely diagnosis? A. Computed tomography, CT, angiography of upper limb vessels. B. Nerve conduction studies. C. Serum uric acid. D. X-ray of the cervical spine. Or E. X-ray of the wrist. The correct answer is B. Nerve conduction studies. This patient's presentation is consistent with carpal tunnel syndrome, or CTS. CTS is caused by the compression of the median nerve as it passes below the flexor retinaculum in the wrist. This causes paresthesia and numbness along the median nerve distribution in the hand. Pain is aggravated at night due to incorrect posturing of the wrist while sleeping. CTS can be caused by repetitive motions of the wrist, such as typing and ringing. It can also be seen in patients with diabetes, rheumatoid arthritis, thyroid disorders, and acromegaly. Although the diagnosis is via clinical provocative tests, such as the Phelan test, which is flexing the wrist at 90 degrees, reproducing the pain, and a positive Tinel sign, which is median nerve percussion causing pain in the area of the median nerve supply in the hand, nerve conduction studies can be used to demonstrate decreased conduction velocities. Answer choice A, CT angiography of the upper limb vessels, is incorrect. This can be used to assess the vascular status in patients with concerning features like decreased pulses and pale skin. Usually a history of fracture mandates this investigation. Answer choice C, serum uric acid, is incorrect. Serum uric acid is typically elevated in gout. Gouty arthritis presents as an inflamed joint, most commonly the first metatarsophalangeal joint, due to deposition of uric acid crystals in the joint. Answer choice D, X-ray of the cervical spine, is incorrect. X-ray of the cervical spine can be used to diagnose cervical rib. A cervical rib can cause compression of the inferior trunk of the brachial plexus, leading to weakness in the motor strength of muscles of both the arm and the forearm, along with clawing affecting the medial 3 fingers. It usually also causes compression of the subclavian artery, which can lead to decreased pulsations distally and discoloration. Answer choice E, X-ray of the wrist, is incorrect. This patient has no history of trauma, and carpal tunnel syndrome is a compression pathology that may not be evident on X-ray. The key learning point here: carpal tunnel syndrome is a disorder characterized by median nerve compression as it enters the wrist through the carpal tunnel. It causes numbness and pain along the distribution of the median nerve in the arm. Diagnosis can be done by provocative tests. Nerve conduction studies would reveal decreased conduction velocities. Okay, that's it for this episode, but don't forget to check out our other episodes. Reminder, you can find these questions and many more at medprep2go.com. If you find this podcast useful, you may also want to check out the Crush Step 1 podcast.